The purpose of this Doc Talk Live is to catch us up on what's going on in New York, but also it's a call for help. I believe you're looking for healthcare personnel in that area to help manage the patients. And I'll say down here, there's a lot of healthcare providers who are just sitting at home quarantining. So Tom, with that said, I'll let you take it from there because your internet's probably better than mine.
Sure. Thank you, Brad, and thank you so much for having me today.
Appreciate it.
So sure, I'm an anesthesiologist with Long Island Anesthesia Physicians. We are a group who provides anesthesia services for 5 outstanding community hospitals in the region out on Long Island. And we are right now seeing a tremendous number and an increasing number of very ill COVID patients. Our ICUs in each of our facilities have been completely filled with very sick patients. Our hospitals and the administrators of the hospitals and the nursing, the CNOs and the CMOs of the hospitals have been unbelievable by opening up additional ICUs within days of each other. So every one of our hospitals have opened up additional ICUs to help care for these patients. With the opening of all these additional ICUs, we need additional staff. Everybody has risen to the occasion to provide those additional services, but it's going to continue to, the needs are going to continue to grow over these next weeks and even months, unfortunately. About 10 days ago or so, myself and Dr. Jeffrey Rubenstein, who we run the group together, we were brainstorming on how we can help in this situation as we saw the need starting to grow. And again, it was very different 10 days ago compared to what it is now. So we started contacting administrators on how we could help, and they were overly thankful to have that help. And we decided, well, how can we convert? We needed to convert our entire anesthesia group into over 100 providers into a group of providers that could work in the ICUs. So really changing the scope of our practice within days. So to do that, we needed to do exactly what you were saying, make sure that we were in a safe environment where our providers, our CRNAs and our physicians, our surgeons, our nurse practitioners, PAs, everyone as part of the LIAP family could join in this fight against COVID to help out in the ICUs and in the hospitals. So we came up with a plan to have a team approach where we're all looking out for each other when we're at work.
So now let's talk a little bit about, I think you're post-call, right? You just got back from work. You spent the night there.
So sure, yes.
Tell me about your night. Tell us what that consisted of. How many patients are on ventilators? What
Sure.
You did last night.
So we provide services at 5 hospitals. And we're actually trying to help out with a handful of other hospitals in the region as well. So for providing nurses and nurse anesthetists as well. So, but for last night, I was there as part of the LIAP COVID team, and again we started this LIAP COVID team about 8 days ago was our first day in the LIAP COVID team.
Wow.
So we have. Yeah, so and it's ramped up very quickly, and a number of the original people, the people that jumped in, feet head first to help this out, we didn't know what our scope of work was. We knew our scope of work was going to be very different than what we're used to, but we just came in and said we are here to help. So and we've developed into these team approaches. So What I was doing yesterday is I was available for any intubations for patients that might be getting sicker on the floors before they get to the ICU. And then when you arrive to one of these situations, when you're called for that, there's a team of people that have the PPE there for you, that have the necessary equipment for me to take care of the patient. The respiratory therapist is there, and we all, or come in and speak to the patient for a moment, let them know that we're going to take care of them, and then have them go off to sleep and provide and get them.
How many patients are on ventilators? How many ventilators do you have left?
So there are there are dozens of patients that are intubated and on ventilators in each of our institutions. Every hospital is different, but it's between 20 and 30 at each hospital, approximately. There are some, not quite this. There is nearly an equal number of ventilators left, but we also have anesthesia machines that can be used for ventilators. We have rapidly set up. Just a couple of days ago, I got a call from one of the hospitals that they're opening up the recovery room as an ICU, and we have our anesthesia ventilators in there. So we accepted that night. I came in to do the first shift because it was really within hours this whole thing got put together. The entire team of nurses made this recovery room into an ICU over hours. I came in, it was all set up. We had a nurse anesthetist with us, and then we were teaching the nurse anesthetist, we were teaching the nurses, the recovery room nurses, how to use these type of ventilators, which no one in the hospital besides for anesthesia providers are used to using. We still have plenty of ventilators left, but they are diminishing. And all of our hospitals kind of find themselves in this situation of having decreasing ventilators. But there is still enough, but they are decreasing. So that's what that's what LIAP has done. We reintroduced ourselves as a group of anesthesiologists who are now doing ICU work, doing all the things that we need. The nurse anesthetists have jumped in and come into being ICU nurses, but more importantly, helping out the ICU nurses. So performing all of the difficult tasks that the ICU nurses perform, and helping them be able to do other tasks and take care of more patients. So we're really there to help out so everybody can take care of more patients. And you're asking, you're exactly right. This is a plea for help today, and I've been for the last week and a half calling so many different people, different programs to see if they can help. Starting to get nice responses, but there's so much. Every day that we think we are almost there, where we have almost enough, we never have enough. Where we almost have enough, I felt like a couple days ago I was 2/3 of the needs, and then the very next day the needs jumped by 40-50%. And this is just the beginning. This is not a couple weeks. We feel like this is a couple months in the making. We do not feel like we are just outside the epicenter of this humanitarian crisis, and it's coming to us. It's here, but it's growing so fast. And so, how can people help? I think you were asking about earlier. You could contact us if you're interested in coming out here to help our nurses, to help our staff, to give our colleagues some time to recharge and then get right back into it. We have a dedicated team of who would get back to you right away. Our credentialing is extremely fast. It's disaster credentialing, emergent disaster credentialing right now. It's quick and it's easy. We provide hotel accommodations for people to come out here, and our website is lianesthesia.com. Again, lianesthesia.com. You can visit that and give us a call to see how you can help us.